from Wello.
Hello.
How are you?
I'm good, Erin. How are you doing?
I'm really good. And I'm really happy that you've agreed to come and talk to me. Thank you very much. I appreciate your time about a really important topic. As we know that May is Mental Health Awareness Month. And I wanted to reach out to some people that I know that they're very passionate about about mental health. And also, people who are working at companies like Wello, that mental health is such a priority. And especially now with this pandemic and the year that this entire world has had to go through. So, let's kick it off by talking to me about what have you seen? What trending have you seen, through Wello, of what's been happening with people with mental health in the pandemic?
So first of all, Erin, so incredibly excited to be here and really great to reconnect with you. It's been a while, but it's always exciting to see things kind of come around and particularly around mental health. As we had chatted about, both of us are really passionate about mental health and making sure proper resourcing is available and supports for people who really need it. But we're seeing some really interesting trends. As you can imagine, there's a lot of research going on. Everybody's doing research. So Morno Chappelle, who just relaunched his LifeWorks on Monday, they do an annual survey. Sun Life does an annual survey, particularly around wellness in the workplace. Obviously, mental health is a big piece of it. But now we're starting to see the grades like Harvard and Deloitte starting to really focus in and hone in on what is the impact of the pandemic. And so I pulled together a few stats for our conversation, because I think they're really helpful to really frame where we're headed. And, one of the things that we're hearing a lot about is experts saying we're headed toward a mental health tsunami. The first wave was very physical. The second wave was a little bit of mental health, but in the third wave, we're seeing this massive impact on mental health. And that impact kind of goes across a person's life, not just their personal life, but their work life as well. And as we know, work environments have changed so incredibly dramatically, right? Like I haven't had
my dog's probably any moment now.
I sent mine out.
Yeah.
She's outside. But 60% of Canadians are saying that they're experiencing mental health issues. And 73% of us have said that our mental health is worse since the beginning of the pandemic. So that's pretty significant. We're also seeing a pretty heightened awareness and concern for others. So about 36% of people are saying, I actually am worried about my coworkers. That came out of a Morno Chappelle LifeWorks study that was done earlier this year. And, Harvard spent a fair amount of time, like they do, Harvard Business School, really looking at work environments. Yeah. And they have found that the average workday is almost an hour longer. 48.5 minutes. And 55% of people are now working on weekends. Yeah. Over 30% of people are saying, I think it's 35% are saying that they work longer, they work harder than they did pre-pandemic. Yeah. And then we start to think about things like, how has that work environment changed? I don't know about you, but I'm on Zoom 10 hours a day. Yeah. And I actually have to stop sometimes and go, no, I just need to, grab a glass of water, run to the ladies' room, whatever that might be, because you don't get that breather. And because you don't have that natural water cooler kind of environment, you don't get into that natural friendship type rhythm that you traditionally would have gotten to in an in-person environment. Yeah. And so, the work spouse, I'll always joke about having work spouses. That concept has kind of gone away. And the focus now is very much on your own personal life. But the truth of the matter is we've seen a pretty significant impact on our personal social interaction. We both have dogs, thank God, because I get to go out and see my neighbors in the evening. But if it's that poor introvert neighbor who I'm desperate to suck every ounce of energy from him, he runs the other direction now as he's seeing me. So, burnout is a real thing. And now burnout is, while it's not a clinical term, and we've had lots of conversation about this in our world, in the medical world in the last couple of months, burnout is not a clinical term. But burnout is a very real thing, and it comes from chronic, prolonged work stress. But then when you kind of put the personal pandemic stress, the isolation on top of it, you've kind of got this healthcare, mental health tsunami environment. So, crazy, but really interesting as we look at it. And from a corporate Canada perspective, the all-in cost of mental health is about $51 billion a year.
Wow.
Like, think about that.
Yeah.
And, when you and I were working together in the old days,
Yeah.
about 40 to 50% of the reasons that someone was off of work on disability were related to mental health. It's over 70 now, and it's climbing.
Wow.
70. And even 70% of the reasons that people are off work. And I actually remember having this conversation with an HR leader at one of the major banks here, and him saying to me, 44% of the reason people are off now is related to mental health. Now it's over 70. So pretty drastic.
Yeah.
And so this is just what we know about. Like, what about those people who are suffering in silence?
Yeah. I mean, if you look at it, if you take out the humanity side of it, look at the economics of it. I mean, look at what it's costing companies when you don't proactively think about the mental health of your associates, what the financial impact can be to a company. It's massive.
It is. Well, if you just think about, short-term and long-term disability costs alone.
Yeah.
We also know, and statistics are very clear on this, if a person goes off on disability because of a mental health issue, if they don't get back to work quickly, the probability of them having repeated absences as a result of goes up exponentially. Yeah. And if someone goes from STD to LTD, their probability of going back to work drops. I think it's somewhere around 40 to 60% that they will never come back. And, this whole ability to get help quickly. So not just to be able to be brave enough, because there's a bravery that's required here, to put your hand up and say, I need help. But you do that. And in some cities and some provinces, you're waiting up to a year to get that help.
Yeah.
So, you just have this trajectory. If you kind of project out costs, you think 70% today, if people put their hands up, we've probably got a whole group that are not.
Yeah.
Is that going to be 80%? And what is the cost, not just on corporate Canada, but on society as well overall?
Yeah. Right? No, it's so true. It's so true. And that's one of the reasons I wanted to talk to you is about what Wello's doing in order to give that level of accessibility back, and how is that that whole idea of being proactive and proactively addressing mental health before it becomes such a major problem. And so tell me about some of the things that Wello is doing to really help other organizations be able to deliver this.
Absolutely. So there's a few different things that we're doing. So if we just think about we call them members. So it's the employees, right? So Wello is a virtual healthcare service. People get it as part of their benefits package, right? Similar to having access to dental benefits or vision. Now they get access to this virtual healthcare environment. And so at the utmost, we actually are just there ready to take a call or a video at any time, 24/7. And that's really important, because what we find is that it's that making that step. And sometimes it's a little bit easier to make that step when it's virtual. And so, we do have a very large pool of highly skilled people. We use as our primary clinicians, nurse practitioners, but we do have physicians as well. But our philosophy is very much this caring, holistic, entire approach, so that, if you call in about something, we're asking questions to make sure we really are at the root of the issue. And it enables us to actually pick up on things, because we're not, oh, you called in because you have a sore finger. Great, we'll deal with that. We're actually asking a bunch of questions. So more family practice type style. And so, you do in 24/7, 365 days a year, you can access into a family practitioner type clinician. But because we saw this happening, and we saw a 50% jump in we call them encounters, the number of times that people connect in with us, a 50% jump between November and February on those being related explicitly to mental health. So the reason that people are calling in, they're saying, I don't feel well. I'm not feeling well. I'm burnt out. I'm anxious.
Yeah.
And so, as we saw this kind of coming down, the tsunami coming down up the beach, we've actually got to do something different. And so what we did was we built out a mental health team. So many organizations have EAP, LifeWorks, EAP, LifeWorks, sorry, the other one now is escaping, but there are a number of EAP providers, and they're a really great stopgap. But not all organizations have them, and not all individuals want to go to those organizations. But getting somebody out into the public system just takes so much time for them, they have to wait. So we built out a team of mental health clinicians, social workers, psychologists, who actually are at the ready. And so we can get appointments for people in drastically less time than if they went out to look for those resources themselves. Certainly there's a cost to that, but we find that many organizations have, as part of benefits packages, you have paramedical that's covered under it. We've also seen, a lot of our partner companies who've invested significantly and just said, they've increased, one organization as an example, increased mental health support to $2,000 per year per employee. And so they're actually putting money in place to be able to do those supports. So the whole thing is, easy, ready access. Sometimes mental health challenges have a physical origin. And so we do need to make sure that we check that as well, which is why it's really important as a first conversation to speak with a medical practitioner, not just a mental health practitioner. And we've got continuity of care so that they can talk back and forth amongst each other to make sure that you are getting the right level of care. So we've launched that. We rolled out nationally that program in February. It's going quite well. With the entire intent of having it at the ready. And then our clinician, our nurse practitioner, our physician as well continues to follow up just to make sure that you're at the right place, you're getting the level of help that you need.
That's great. It's so important to know that you can partner with other organizations to help you with this, because a lot of organizations, they don't have that that expertise in-house. They know they want to do something for their associates and be proactive, but they don't know exactly what to do. So it's fantastic to have companies like Wello to be able to deliver that and offer that to companies to help them with that, because it's not a lot of companies that have associates who are going off on leave. They were like, oh, what could I have done? What could I have done to help this? And so now they know, right?
Well, and it's interesting because when you and I worked together before, we worked around data. It was all about data and insight and what the data could tell you. And while we never put data forward that would identify an individual, we actually do gather data quite a bit. So we can look at trending data and we can start to identify that, a national organization has, we are seeing an increase in mental health encounters in this particular location. And it really gives them the heads up that, something else is going on there. And often they can tie it back to some type of business reason. But now they actually have the tools to go, wow, we have to take action. We have to do other things. And so that's where you see organizations start to put more money into benefits packages around mental health. They start to bring in providers. I have a friend who's a psychologist who did a presentation at a law firm yesterday specific to teenage mental health through the pandemic. Oh. Right? So you're starting to see organizations now kind of go, wow, this is something we need to deal with. How do we provide these supports? And, even things as simple as, and I'm sure you're doing this with your team as well, but, in this crazy virtual environment, you've got to actually set out time for coffee chats. You need to take time at the beginning, like we did, of every conversation. So how are things and what's up with the kids and what's happening with you to really start to connect in. And as leaders and as managers, we have to go over and above on listening for those cues of someone who's, been okay for the last week. Well, what does okay mean? What's going on with you? And learning when you have to turn the camera off to make someone feel a little more comfortable to talk to you. Oh, let's do a walking chat today. So those are the kinds of things that we're trying to do. We also, this is our business, right? So we pride ourselves on being pretty good at it. We hope. But with Mental Health Month in particular, we're doing some things. Last May, we did a whole CBT, DBT training program with our psychologist. It was available to all employees and their families, very practical. approach on how to manage the stress and anxiety around the pandemic specifically. We also do executive social hours, and it goes out to the whole team. We do 4 or 5 of them once a month, and people kind of hop in. We play games, we have fun. It's an hour, right?
Yeah.
And making sure that people are resilient. So we've done some management training around resiliency, which now we've just rolled out to the entire company.
Yeah.
And we're quite happy if, an employee brings a spouse or one of their kids with them to participate in it.
Yeah.
Resiliency, like the only reason we're actually making this through this, frankly, is that we're all resilient people, right?
Yeah. It's such an important part of a leader is the idea of resilience. And, it sounds like you kind of touched on it, but touched on more on what you're doing to ensure the mental health hygiene of your direct reports or your team. So what are you little things that you're doing to ensure that they're making mental health hygiene a priority?
Well, there's a few things. I have instituted things like walking meetings. Not all meetings have to be over Zoom.
Yeah.
And particularly as the weather has gotten better.
Yeah.
Doing those kinds of things. It's also important to give them tools that they can use with their teams. Like, what are those words, right? So you're actually explicitly talking about, wow, something happened, I'm feeling really stressed. And you're giving them a safe environment to be able to do that. So much of it literally is just listening and having kind of this arsenal of tools that you can draw on. And the arsenal of tools in my toolkit are, we do have a great EAP provider, which is LifeWorks. We have the LifeWorks platform that we have access to. There's lots of resources kind of in market, which we've pulled together by nature of our business. We have a really phenomenal medical director. We have a psychologist at our ready. And things like the resiliency training, like just calling it out. Wow, I'm not feeling resilient today. What are those things that I can put in place to make myself feel more in control? Things like micro goals, recognition, all of the things that were important before are way more important now. Like taking a moment and saying to somebody, how are you? Your mom was sick. How's your mom doing? How are you coping with that? So I probably spend 30% of my day, my regular day, asking questions about people. And that puts some extra load on me in terms of making sure my work gets done. But it really helps them feel safe. And so I do get those, I'm really stressed out calls.
Yeah.
And in some cases, it's saying to somebody, you know what? Your kid seems to be having a tough time. Why don't you take the afternoon? Just take the afternoon. You've been working since, I have people that across the country. Mm-hmm. I have a clinical lead who starts work often between 5 and 6.
Yeah.
My head of my medical admin team, she starts between 5 and 6.
Yeah.
If they take a few hours off in the afternoon to spend on themselves or one of their family members, that's really good in for me because they'll come back more refreshed.
Yeah.
Vacations. I don't know about you guys, but it's hard to get. I don't want to take vacation unless I can get on a plane.
I know.
But we've been really diligent. It's vacation time. When is your vacation? Yeah. What are you going to do?
Yeah.
Define, helping them to kind of put some parameters and definition around that. What are you doing? Yeah, encouraging. What types of things are you doing, Erin?
For my team?
Mm-hmm.
Very similar. The walking thing is fun. I do that as well with my team. Encouraging their time off and saying to them, can you give me a calendar of when you're taking your time off this summer? I'm not going to hold you to it. I just want to know when it is, just to give them that safe feeling that, oh, okay, good. I'm not being expected to keep working, all the time. It's submitting a vacation request isn't a bad thing. Just ensure being proactive that way and saying, can you give that to me? And the same thing, just saying, hey, how's it going? And kicking off a meeting, and sometimes, spending a meeting just asking how they're doing and finding out, and also being really intuitive, I think is a big thing too. It's when you pay attention all the time, then it doesn't take that, it's not that hard to find little clues of something's not right there and I need to follow up with them. So it's just being really, transparent about yourself too, because when you are and you express your own frustrations or what you're going through, then your team feels more comfortable also doing the same. So it's transparency is a really big tactic as well that I've always liked to use.
Yeah, and certainly we found that across the board, even on business transparency, the why you do things, right? When you're in one environment, I have a team of 50 people.
Yeah.
They're all over the country. We never get together.
Yeah.
And, I can't walk into a room and say, hey, and start to just quietly and naturally get to know them. And so, I actually set up meetings. I've been doing it now for the last 3 months so that I've met every single person for a half an hour face to face.
Yeah.
And part of that is really just so that they can get to know that I'm human. I started doing something called the Monday Moment, which is a video where it's, sometimes it's just fun, but the whole goal of the video is just improve communication on what's coming down the pipe, what's important, why it's important. And transparency is a huge part of that. I've also found, and I'm sure you have as well, that it's mirroring the right behaviors. So if one individual on my team was always available 24/7.
Yeah.
And, I finally kept saying to her, you need to stop that.
Yeah.
No, I've got too much work to do. So I just stopped responding to her in the off hours. And she was frustrated initially and then said, I said, I don't want to respond because I want you to see that you don't need to work like this.
Yeah.
So how do we help with that? And really good on her, right? Like super dedicated, all of those good things, but making sure that we set some boundaries and make it okay not to be available.
Yeah, no.
24/7. Yeah. Right. I think that's a big thing.
It is. You have always demonstrated to me what a fantastic leader you are, Maria. And I knew when I would talk to you about this, it would come through even lighter, brighter, and more obvious. And so thank you so much. I really appreciate your time. It's such an important topic, and you did a great job describing how as leaders we can all find ways to ensure that we are proactively helping ourselves and also our teams with mental health. So thank you so much.
Well, thanks. It's been an absolute pleasure to do this with you, and really great to see you. We'll talk soon. Okay. Thanks.
All right. Bye.
Bye.